Hi, it's Jessica DaMassa with WTF Health. Joining me right now, I have Xavier Palomer. He is the CEO and founder of Psious. So good to have you here with us.
Thank you very much.
All right, so tell us about Psious. What do you guys do?
We've developed a virtual reality solution for mental health professionals so they can deliver faster and more efficient and more efficacious treatments to their patients.
I love a virtual reality startup. So tell me a little bit about exactly how this works and what conditions that you're helping clinicians treat.
So we help therapists treat more than 25 different conditions, and the product consists on three main parts. Of course, one is the virtual reality headset for the patient, where they see different videos, different computer-generated fake environments. Then the second part is the control panel for the therapist, where the therapist controls what's going on inside the virtual reality experience. And the third part is the physiological sensor for the patient, where we monitor how the patient reacts to that virtual reality environment. So the therapist can accommodate, can change what's going on the virtual reality experience, so have a better treatment for that specific patient.
Okay, so I understand you are selling directly to the clinician for this to be prescribed to their patient, correct?
That's correct, yeah.
And then does the patient have to be in the office then for the clinician to be able to track what's going on with their biometrics and things, or can they do this remote?
They can do both. They can do at the office because it's what they usually do, but they can do it also remotely, so on different sites, but same time. But they can do it also remotely without being connected at the same time. So some kind of homework, self-applied, but always supervised by the physician.
And it doesn't matter which kind of virtual reality headset they have, right?
No, it's completely hardware agnostic. I mean, not all of them, but most of the hardware for sure.
Okay, so tell me, I guess, a little bit about your business then too. So where are you guys based? And give us a sense of how many customers you have currently working on the system.
So we are based in Barcelona, in a place called Barcelona Health Hub, a very interesting digital health hub in Barcelona. And we have customers today. We are present in more than 25 countries. We have 1,000 mental health professionals using the tool, mental health professionals from all different sizes, all the way from a solo practitioners with an office alone, all the way to very large healthcare systems like NHS, private healthcare systems, or also insurance companies. We are mainly focused on Spain, the US, and the UK.
Okay, and are you currently being reimbursed for the way that this is being used?
Yeah, we are lucky enough that we are reimbursed in the US.
That's a huge accomplishment. Not every digital therapeutic can claim that. All right, so about your business, I understand you guys just closed a round. So tell us a little bit about that. You said 8 million, I think?
I said 8 million, yes. Yeah, we just closed a round 6 months ago, 8 million, with two main goals, right? One is to grow the customer base we have, and we are growing quite fast. We are a SaaS, we are a SaaS model. Our business model is a SaaS, subscription-based model. And we are growing 15-20% month over month, which is very, very interesting for a SaaS company. And the second main goal is the clinical part, right? Growing the clinical evidence behind our tool, how realistic, how real is this, how efficient, how effective is this for the patient, for the therapist. And that's the second main goal, right? And we are performing quite well in both.
Say a little bit more about that. So do you have any clinical studies that you've done already right now to show efficacy?
Yes, we are conducting today 11 clinical trials. The first one is going to be published within a couple of weeks, so I'm afraid I cannot give you any numbers, but trust me, it's going to be very, very interesting.
Okay, well, if you're excited about it, then the numbers must be good. Okay, good. Well, we'll leave it there. Xavier, thank you so much for joining us. It's a pleasure to speak with you and to learn more about Psious.
My pleasure.
Thank you. I'm Jessica DaMassa with WTF Health. Thanks for joining us.